YouTube. So today is my 6th day post-op. I'm just now starting to get a little bit of bruising that's under this breast right here. The bruising is about that long, and it's whenever I do my massages, like, it doesn't hurt anymore doing this, and I don't have gurgling like I did before. But doing like this hurts really bad. And then you're supposed to like go like this, like you're trying to get your milk out, you know, you're lactating. But just going like this it hurts really bad, and it hurts like all the way like down and through here. And also like right here is really sore, and under here, right here is sore. Like it's all bruised feeling. But tomorrow is my 1-week checkup with my doctor, so hopefully he'll say everything looks good. I'll update y'all about that tomorrow. I stopped taking my pain medicine at 4 days, I think, and I haven't needed anything. Just the Neurontin that I take for it, that the doctor prescribed for the nerve pain, which is that burning, shooting sensation you'll get in your breast. And I've been taking Tylenol, and I have taken a couple Motrin, just because, you know, the supplements I'm taking are supposed to help prevent bruising. And the Motrin, yes, it can cause bleeding, but it's for inflammation, and to me, the benefits kind of outweigh, you know, the bruising risk. And I've noticed a lot of relief with the Motrin. I take like an 800 milligram Motrin. But yesterday I didn't have any kind of narcotics. I didn't even have my suboxone. Today I went past lunchtime. Didn't have anything, but my withdrawals were, like, I felt like I was going to crawl out of my skin. Non-stop yawning, stretching the jaw. Non-stop involuntarily stretching the legs because my legs were cramping. And then whenever you stretch your legs, like, everything stretches on you, just like involuntary. And so my chest was stretching too, and it was just hurting, and it was over and over and over, like every 5 minutes maybe, like, or more often. And just bad shakes. Like, I think I pretty much wore the rocker off of my recliner. Pretty bad. Last night I read like 8 pages front and back, trying to keep myself busy, and I ended up drinking some sleepy time tea. It's a herbal tea from Walmart or Publix or whatever. It has chamomile and stuff in it to help relax you. I drank that, and I took my Neurontin last night and 2 Phenagrin, which makes me really sleepy. So I was hoping that would get me through the night, and it did. I just didn't go to bed till like 2 o'clock in the morning. Then I woke up at 7. But I was just trying to keep myself occupied. I really didn't want to take suboxone again. But today after lunch, and my body temperature fluctuating, like I'll be freezing, then I'll be burning up, like literally feeling like I'm on fire. So I ended up taking a half of suboxone today after lunch, and it's nighttime now, and I just took another half of suboxone. So I was on 3 a day, and that is a high dose. Don't need any comments about it. Keep it to yourself. Really don't care what you have to say about it. That's what was a suitable dose for me. But hopefully I can start taking from now on just half of one twice a day. But tomorrow we'll see how it goes. I'm hoping and praying that I can do that, and then, you know, take a half of one and then a quarter of one, and then just keep reducing it to nothing. So I'm hopeful on that. I'm really hoping that that's the case, because I read an article the other day that if you start taking opioids or drugs of any kind at a young age and used for a long time, that you have to be on a lifelong maintenance therapy, like methadone, suboxone, antabuse, whatever, you know, you're addicted to, something that helps with that, a maintenance for it. Just because the withdrawals can last many, many years. And not just the really bad physical withdrawals you go through, but mental withdrawals. Like, if you start using when you're 14 years old and use for a long time, even if you don't use a lot, but you use regularly for a long time, if you start using at 14, like I started using at 13, your brain is still developing at that age. So when you stop using opioids after many, many years of using them, your brain has been damaged because of the disease of addiction and because of the drugs. And your dopamine receptors, stuff that makes you, that releases the natural endorphins and chemicals in your brain, are damaged. So a lot of addicts, and this is not everybody, you know, this is an article I read that was issued by the National, Disease of Addiction Institute. It's a medical institute that actually specializes in the disease of addiction. This is something they put out by their statistics. So, a lot of people who have used for a long time, starting at a really young age because their brain was developing and was not able to fully develop, and then their brain was damaged on top of that. Some people might not ever be able to feel real pleasure like normal people can. So that's why they're required to be on some type of lifelong maintenance, so they can feel normal. And you notice how I'm doing this, because what is really normal? Nobody really knows what normal is. What can be normal for me, what I think is normal, what I feel like would be normal for somebody, might not really be what's normal for somebody who's never used. It might just not be realistic. So I'm saying normal, to be whatever your normal is. So, and I think that's very realistic, and I can see that. Because a lot of people take a maintenance drug because they want to feel normal. They don't want to be high. They want to feel normal. And if you're not an addict, there's no way for you to understand that. I'm sorry. And if you are an addict and you've been blessed and have recovered 100% and are normal, I am happy for you and God bless you. But that's not the case for everybody. But anyways, my goal is to hopefully be off of suboxone completely one day. Whether that's a realistic goal, I don't know. But that is my goal. But anyways, back to my surgery. The Percocet that I took after surgery really didn't do a whole lot. I was taking Tylenol on top of it. The Neurontin and the Phenigrin, that combination, I believe, really helped me the most. Because I had to take the Percocet every 4 hours. Took 2 every 4 hours. It was just 5 milligrams, which was nothing. Because I had fentanyl after I was pregnant, after my delivery, to help with the pain because there were some issues. And the fentanyl, they gave me 2 doses back to back, and it did nothing. So 5 milligrams of Percocet obviously did not do anything for me. But 4 hours apart for the Percocet, 8 hours apart for the Neurontin. And I noticed when it was time to take my next Neurontin dose, I was starting to get a lot of the shooting, burning pain in here. And in the morning, because I'm not waking up in the middle of the night to take my doses anymore, in the morning when I wake up, it is so sore. And I'm not sleeping inclined anymore, which I'm supposed to, but I can't do it, and I'm just tired. So I've been sleeping flat, like with my pillow. In the morning when I wake up, I'm really, really sore. So sore. Everything's on fire and just hurts. Like, it feels like my chest has been, like, fucking attacked by crabs. I'm sorry for that word. Attacked by crabs and stingrays and been beaten with a bat. That's how it feels. And jellyfish. It just hurts really, really bad. Jellyfish is the best analogy I could use, probably. But anyway. Yeah, so Neurontin first thing in the morning, like within 15-20 minutes, it's helped. But whenever I sit up in the morning, it takes me a minute to sit up because I have to, like, sway myself back and forth to eventually get myself up out of the flat position because I can't pull myself up with my arms. It's not supposed to lift anything more than 10 pounds for at least, like, 2 weeks. And I'm a little bit more than 10 pounds, in case you can't tell. Yeah. So, can't really pull myself up or push myself up because it just kills this area. So once I get myself up, it feels like everything drops, like, whoa, and then it really, like, just throbs and burns for a little bit. Take my Neurontin, take some Tylenol, Motrin, you know, whatever. It goes away after, like, 20-30 minutes, maybe total. I don't know. Just guessing. But not too long after it goes away. That's all for right now. I will show y'all, I will try to remember to show y'all the card that I got for the next recording I do. So if anybody has any questions, just let me know. No negative comments. And that's it. Thank you everybody for watching.